All right, welcome to the podcast, Dr. Linda and Dr. Crystal. I am like so excited. Like I have to, and I apologize to past guests, but like I think this is probably the most excited I've been to interview people. I just feel like now that especially that I've met you personally, I am so excited for you to come on here and share all of the amazing stuff that you guys are doing in your office that nobody else really is. So first of all, thank you and welcome and coming on today. I really appreciate it.
Well, thank you so
Thank
much.
you.
Thanks
Thank
for
you for
having
having us.
me.
Absolutely. So, people would have already heard a little bit about your bios before listening to this, but I'd love to hear if you guys each want to take like a couple minutes and share your journey into pediatric dentistry and like what inspired your change in philosophy of really focusing on this whole body health wellness.
Well, that's great. And I'm sure a lot of people know a lot of other ones who are struggling with sleeping, snoring, migraines, all of those things. And if you didn't know before, now you know one. Still working through it. And I knew when I was 9 years old that I was going to be a dentist. And that was because my little brother had a toothache. We didn't know back then that that's what it was. He was just in a lot of pain and couldn't sleep for many nights. And then when a dentist saw him and took that tooth out, he was like a different kid. And I said, whatever this kind of doctor is, that's what I want to be. And so I've set out for over 35 years as a dentist doing that. However, later on in my life, I just suddenly got sick and no one could tell what was wrong with me. Finally, the fifth internist took a look in my mouth and said, "Oh, you must have sleep apnea." If you were there, you're like, what is she talking about? Because I was rolling my eyes at the back of my head, like, what is she talking about? But she was right. And my sleep test came back as a moderate sleep apnea. But my symptoms were really severe. And I got on a CPAP, and those symptoms went away. I wore that CPAP religiously, the best I could, for a long time, and then it stopped working. And when it stopped working, the option was for me to have my jaws broken so that I could have more room for my tongue, which my gut said no, I didn't want to do that. So in looking for answers for myself, I was at the AAMS Congress in Chicago in 2017, and everybody from everywhere around the world was talking about how your face grows, how your jaws grows, your tongue, your muscles, that's this. All of those contribute to how well you sleep and breathe, even in adulthood. And at that congress, it dawned on me, wow, this is what's going on with me. And I came home, looked at photos of myself that as early as I could get was the earliest I got was 9 months. And all the signs were there. There's that open mouth, the face blanks, most all of those were there. And right that moment when it clicked, I
Mhm.
thought, we see babies as early as 2 days old for breastfeeding support. The
Mhm.
signs were already there.
Mhm.
So I have to do something. And that's how the practice pivoted to
Mhm.
making sure and connecting the dots for parents so that we can get children breathing easily and sleeping well as early as infancy. So that's how we got to this point for me. Mhm.
Awesome. Awesome. And Dr. Crystal, let's hear your story.
Yeah, so I'd always wanted to be in healthcare and work with kids. And so following in the footsteps of, this incredible mom, this incredible woman, I'd already, worked in the practice as a teenager, sterilizing and just kind of watching her do these amazing procedures on kids proactively, something, even early orthodontics, early intervention, laser therapy, laser fillings, things like that before anybody was talking about it.
Mhm.
So, graduating dental school and finishing, I knew that hey, I'm gonna be practicing with her because she's doing things that you've never seen, and it's changing kids' lives. And um, joining the practice in 2018. That was when I knew I was in a second residency. I knew it was going to happen after practicing in Houston for about 3 years. I knew that coming back, I was going to go back to learning, and I had to keep myself open and keep myself open to unlearning certain procedures and things like that. But even as I started learning, craniosteopathy, airway, sleep, more laser things, I started to see some of the issues that I had myself. I had braces growing up. I sucked my thumb till I was 13 years old. So that was a thing, and I had the braces, but my teeth were still, they were nice and straight, but my jaws, I knew they were off. And then my sleep was off, knowing what I knew. And so that's when I started my journey, the alpha appliance, laser releases, osteopathic care, all of that, to even connect the dots for me for what I was already learning, for me to be feeling it as well, and feeling and seeing the successes I was having and the successes we were having with our patients. I was, it further continues to confirm and solidify why we do this and why we have to get the word out, because it is confusing. I was one of those. I'm a straight laced scientist nerd. Like, let me see the evidence. How dare you? We learned this in school already. Like, nobody said anything about this.
Yep.
And you just start understanding what education actually is in the forms that it comes in, and why it's so important to always keep an open mind, because the magic of healing is more than just what you learn in paper or on the books, which are typically outdated, about 50 years. So that's what that's what I started to understand. And so, yeah, it's been amazing seeing the changes in our patients and in those young kids, and seeing what they show up as. So
Yeah, and I love your practice is so unique. And although I hope if we were to like have this conversation in a decade or especially 2 decades, like that would be the norm, traditional
yes,
pediatric dental practice,
I
right? I
hope.
know that's like
Yeah.
your guys' mission. But for anybody not listening, like I want to talk about, I mean, I know that, we hear other providers talk about like 3, 4-year-olds. So I want to focus on the group that like nobody talks about. They're scared to treat. They don't think there is anything they can do as a pediatric dentist. So talking about that 0 to 2 age range, and I want to, you guys have your womb to grow wellness. So tell us like, what is that? How did that come to be born? And let's talk a little bit more about like the nitty gritty of what you're doing with these families, like before birth.
Very well. So, Womb to Grow Wellness became a thing that must be done because we understand that the dysfunction starts early. And sometimes the parents say, so how do we prevent this? I go, well, first of all, the best time to feed a baby is 2 years before you're ready to make it. And everybody's eyes go like, oh my God, we're already late. But anyway, it's not, that is the truth. However, not many people understand that, nor will they be ready for that. And so then we see a lot of the moms coming in with the children, and we could see the dysfunction that they themselves had. And sometimes they recognize it themselves and they're asking us, who can we do this for us? What do you recommend? What should we do? And we've already learned all of these things. And so a lot of times we know that when we heal the parents, the children get healed quicker and sooner than that. And so for us, we thought, really the reason I wake up every morning is to go to work knowing that any child who comes in contact with us in a practice will be their healthiest, will be their best. And so I thought, okay, part of getting to that purpose and that goal will be to make sure they have the best start. And so the best start, the best we can reach will be, all right, if mom's planning to be pregnant, what are some of the things they can do to make sure that they're healthy and that their child will be healthier? Now, if they're already pregnant, what are some of the things they could be doing? We want to make sure they're breathing through their breathing is good. They're breathing through their nose. They're keeping up nasal hygiene. They're checking up on, they're already seeing people but we kind of look and say, are you checking up to make sure you have these particular supplements? How is your hygiene? and all of those kinds of things. Maybe they can get some laser therapy to make sure they're getting good blood flow, make sure that their nervous system is, they don't need to have like high sympathetic drive, which will also affect the baby, because the environment that the baby grows influences that baby. And that's how it came about anyway. So
So I want to talk a bit about the nervous system, because I feel like some people think like talking about the nervous system and traumas and things like this are like buzzwords. And like we hear all the time people say like my nerves are shot. And like, okay, but what are we going to do about that? Because do you know that like what that is doing to your body? So if we can talk a little bit about the nervous system and how important it is, like if we can focus on this like pre-birth stage, so moms in pregnancy, like
mhm.
why is it so important? Like how can a mom who's in a dysregulatory state, how does that impact, well, not only the mom obviously, but also the child, like the unborn child?
So, an amazing question. And this topic is like, we could talk all day,
Mhm.
but for sure, understanding if mom has PMD,
Mhm.
right, jaw issues, she's having headaches, tightness in her tissues, in her fascia, diaphragm, tongue tie, lip tie, or any kind of fascial restriction, because we know the tongue is connected to the tip of the toes through body fascia, and also is supplied by the nervous system, the nerves, right? I think people forget that the cranial nerves do things to the body. And
Mhm.
so therefore it manifests in how, in the behaviors, headaches and different things like that, and different patterning. So if you can help to quell down vagal tone, help to quell down fascial muscle restriction, and those kinds of things, help to get the breathing as optimal as possible, then you're going to have a better formed child. And there are many studies on this, right? Because at the end of the day, the human body will sacrifice everything but breathing.
Mhm.
So that sounds like a buzzword because we're all learning about it now, but it's, if we sit and think about it, everything else will then follow, right? So for us, that's why we realize with moms, it's not, we can't do too many, drastic things. You can't really do, extensive expansion, so to speak, maybe before they have a baby, if they decide, if, and there's some moms now that are preparing themselves, like what
Mhm.
we said, they're like, okay, I want to have a baby in, 2 years. I want to start now with myself, right? But
Yeah.
if mom is pregnant, being able to put her in a comfortable splint of sorts, that's not just a uh, what do you call it? A mouth guard or a bite guard. It's one that actually is working for the nervous system and working in conjunction with the biomimetic in a sense. Even putting in an alpha appliance, being able to do smaller procedures, laser procedures, things like that, to help relax the patient, being able to send them to where they should go at the time that they should go, right? Certain osteopaths that do manual manipulation or baby friendly or nervous system related chiro and PT to help preparing. This is an Olympic event to have a baby, right?
Right.
So you have to train like an athlete, the mama
Mhm.
league, right?
Yes.
So that's exactly how we should be thinking when having a baby. It's not, we should just sit and always just think the body's going to sacrifice everything but breathing.
Mhm.
What does all of that mean then? Which muscles do I need to get prepared for that? Which
Mhm.
way, and how does my muscle of my faces, or how do I coordinate things? How do I coordinate my breathing? And what are the obstacles I have now? So
Mhm.
that's typically pre-birth and things like that. With regards to the nervous system, because again, relaxing the vagal tone, relaxing muscle tension that could be compressing nerves as
Mhm.
well, will also help for things to flow more free as far as
Are
electricity.
there any like quick easy exercises that you tell people to do that they can institute throughout the day that can help improve vagal tone?
I'm not sure,
Oh,
Dr. Linda, maybe there are
yeah.
a couple things, but
Yeah, a couple of things. And I always start with telling them to start with nasal hygiene.
mhm.
Nasal hygiene meaning you do the saline rinse or use a clear rinse or saline drops, whatever it is that you prefer to. do at least daily. However, if you have a cold, now you have to do it twice a day. Ideally, it's twice a day, but they already have so many things that they're doing. And then we tell part of your expertise about the tongue posture. And we tell them to be more aware of their tongue posture. If you're in the car, you can try to get your tongue up and, be more aware of how you're swallowing and things like that. So, and of course, get enough good quality food and be hydrate yourself very well. And of course, a lot of chewing as well. It's nice. Always chewing is good. Chewing food, hard, crunchy fruit, natural foods are always going to be helpful as well.
Right.
So,
And what are some ways that like support that you can give to expecting parents? Like I think about this so much now because, obviously I just had my babies, they're 15 months and all my friends are having kids and like having all the knowledge I have, like, okay, here's an example, right? My girls were born premature, 34 and a half weeks, we're in the NICU. The NICU was fantastic, but nobody there agreed that they were tongue-tied, lip-tied, cheek-tied, like nobody at all. But I know enough to know, right? So I had my people lined up. And so what are things that dental offices can be doing to prepare these families ahead of time to support better airway development in their children, to support better feeding capabilities in their children, right? Even like when it comes to, so one of my daughters ended up not being able to breastfeed, so she was bottle fed. But like there's so many bottles out there on the market, right? And so I knew which were the good ones to choose. So can you talk a little bit about like the support that you give on that end and how we can help these children
yeah.
by even just the products that we choose?
Wow, this was great. This is really very important, and I probably need to put more time in it to be more comprehensive. However, when we see the moms come in and the children, besides the ones who are asking, the ones we see that are obviously pregnant or tell us they're pregnant, I go, okay, this is great. Great news. And when you have this baby, and if by the second day breastfeeding is painful at all, you need to come here.
Yeah.
And they're looking at us like, what? They don't have teeth. I said, you need to come because that's telling us there's something not quite right. And it doesn't necessarily mean that there's something that needs to be cut. There's something that is not right, and we have the resources to figure out where do you need to go to get the help you need if you want to breastfeed. And even if you didn't want to breastfeed, if you wanted a bottle feed, I have a sample nipple that I like in the office. I'm not affiliated with them in any form, shape, or form. But for all of what I have seen in the market, that nipple comes in easily, goes around, and then just about the right amount of breath that when the baby has it and their lips get to the whole nipple in, it actually helps to widen the jaw. And I've seen so many different forms and so many different nipples, and they're not the same. And the same person who developed that bottle developed the Dr. Brown bottle, but after the Dr. Brown bottle. So it's not the
Interesting.
same as Dr. Brown
Yeah,
bottle.
because there's
If it's
so
okay.
many people that use the Dr. Brown's bottles.
Yes, and if it's okay, I would say the name is a Juvie Boob bottle. I don't know who makes them or where they're from, but you look at the shape, you see how it's a gradual flow. And when I have babies in, when I'm testing to see their latch, and I put my finger in to get to that back portion of the tongue, which is the important part that goes to stimulate the brain, to bring in serotonin and dopamine, and you just see their legs going like this. When I get to that point, if I bring my finger out and put it against that nipple, is the same length. Because most of the nipples are much shorter. And so they're feeding into the dysfunction. So they're asking the child or the baby to still use their chin instead of using under here. And so those are, I show them, some of them by then they already have
Right.
what do you call that thing? The baby shower list and stuff.
Yeah.
Yep.
The registry.
I say cancel all these things here. This is the bottle you're gonna need. And yes, it may be a little difficult for the baby to adapt to it, but you're training for good function and not training into the dysfunction. Because you can actually use a spoon. You can use an open cup to feed the baby. You can feed the baby any which way, anyhow. I've seen day-old babies like holding a cup to feed themselves because it's a natural instinct that they should all have. So those are some of the things that we do say to them. Obviously, now that we're doing adults, we say, we talk about their own breathing and things like that. And, we call this, when we do the laser therapy on them with their parent, with their mom, with the babies, we call it mama lays, really, which is a non-surgical laser treatment, a light treatment, sort of kind of like red light, but it goes a lot deeper into the layers of the skin, that where the nervous system is, to let the fascia flow. Because our whole body is motion. We're all 90-some% water. It's got to be flowing. Whenever it's static, that's where we have disease. That's where it's harder for the body to function. That's how you have inflammation. And that's where there's no health.
And there needs to be an understanding too that mom and baby are literally one nervous system during this time, which is another reason why it's so important that both patients are treated. They are one patient.
We're incorporating dads now too.
Yeah, and dads as well. Exactly.
Yeah.
The whole family unit,
Yeah.
right? They're feeding off of each other. And sometimes when a patient is inconsolable, moms are like at their wits' end. We sometimes have to tell mom, like, you need to be taking care of yourself as well, and understand that. And you made a great point about your babies being premature, and they're beautiful, just like very healthy. But with understanding that they were premature is then also that there needs to be a proactive response to their feeding, their breathing, and their growth and development. And that's something, some parents are just like, they're just happy that the baby came out okay and they're all right, which is what we're okay with. But even if your baby came out not premature, our bodies have changed, our whole environment has changed, birthing practices have changed to the point where everybody needs some kind of help. Every child needs that, some kind of proactive help, which is another reason why we went into this to say, okay, we can't just ignore it just because there are common standards that look normal.
It's so, I obviously, like, I am learning so much. Like, I know this stuff from being a clinician, but being able to experience it as a mom, like, my babies weren't even, they were still supposed to be in my womb, right? And so here we are expecting all these things from them.
Exactly.
And even, I mean, obviously this is not a podcast where we're going to talk about like immunizations and things like that, but some of them in the beginning, I was like, no, my babies aren't supposed to be here. So I'm sorry, but their nervous systems are so dysregulated. We're not doing anything to them right now until I can get them in a better state. And so I loved how you guys said, I forget who it was, but you guys were talking about it's not just for them to come to your office for you to release the tongue. It's for you to find out what do they need to do first and provide the resources. Not that we might not end up having to release the tongue.
Exactly.
But so if you can talk a little bit about that, because I feel like sometimes teledural tissue releases get this bad rep, like they didn't work, but we didn't set the patient up for best success. So talk to me a little bit what that looks like in your practice.
Well, so we get a call from the parent. Obviously, we ask the questions and find out what's going on. How did this baby come into the world? That's going to give us an idea ahead of time what kind of trauma, what kind of compressive forces that child has been through. If they came by CS cesarean section, that's a whole different process. If they had forceps to get the delivery or vacuum, I don't think they're doing forceps. I don't know, one of the three, they're not doing as much.
Vacuum, I don't think.
Yeah, so, but that's a different process. And if the labor was long, that's a different process. If the labor was fast, that's a different process. So all of those we get in a sense of what did this baby come with? And I always ask the question, did they cry as soon as they came out? If they didn't cry as soon as they came out, they had a little bit of a delay, right? And did they do the breast crawl, which is the immediate foundation for the nervous system to start building on. So if they didn't do a breast crawl, that's another bucket of things that we're looking to be sure that we're taking into account. And then when they come, and then what's their feeding like? Well, usually they're having trouble latching, that's why they're calling us. And then they come in and we look to see, is there spit up? Is the baby spitting up? Are they pulling off? What exactly are they doing on the breast? Is the mom's nipples compressed like a lipstick? Things like that. The baby falling asleep on the breast. And the one mom just said, oh my, this baby is just so dramatic. And when I watched what the baby was doing, he would go, and then stop. I said, try doing that yourself. Try lifting your whole head. Try to move your tongue like you're going to suck on something, and see how she tried it herself. And she said, oh, I thought he was just being dramatic. No, this child is suffering. Anyway, so anyhow, we come in, we
And
check.
body tension.
Yeah, and then body tension, of course. And then a lot of the moms, they know it, they feel it. And obviously, when they come in, we do a knee-to-knee exam and we check the reflexes. And if I put my finger here around it, I expect him to let go like that. All of those. You check the palmar, we'll check on the hip. We go like, how tight is this baby? Look at how they're even nursing, or if they did, or how they were sitting in the car seat, and they have their neck twisted one side. Sometimes they're shaped like a C. All of those mean something. And then you go on the inside, okay, before I even check the ties and all of that. And sometimes you look, the one that is very obvious, okay, it's tied to the tip. All right, okay, if it's tied to the tip, I'm expecting to see a high voltage palate, because that means that tongue hasn't moved for 9 months in utero. That's going to be a very difficult case. Yes, tied to the tip, people want to go immediately, just release it, just release it. They can still move, but just release it, just release it. There's a lot of nervous system thing that the nervous system is not ready. You just can't just release it. And some of the things you do ahead of time, trying to get that nervous system on board, is going to help with feeding. So that becomes very important. So anyway, so we do all of those, and I start to look and say, okay, how much resources do they have even? And if you put the pulse ox on and they're just about just 95, 96, they don't have enough, period. And so, yeah, the oxygenation should be at least 98, so, and then you're looking, so you already know the battery is not on just yet. Dr. Lois Lunny is one that I learned a lot of these things from, in the sense, like she always says, your body needs a double D battery, but you only have a AAA battery. And I'm going, oh, that makes a lot of sense. So if the baby is coming in with all of those, the last thing you want to do is to just go cut and add more trauma to a nervous system that is not ready. And believe me, I didn't always know this, all right? Because when I started doing babies 20 years ago, 2006, and if I was that person, if they came with a tie and they said, oh, I cut it, and they got better, I had them feed in the
Beautiful
office.
surgery.
Yeah, it was a miracle surgery then. And then 6 months down the road, they were choking on solids. And I go, oh, no, not my problem, but it was my problem. Anyway, so with knowing more with what I know now, you come to our office and you expecting it to get cut that day, you are not a good fit. And I actually I don't do it that way. And I'm okay with it. Some parents get upset on Facebook and why didn't they cut it? Why didn't they cut it? I said in the office there, I said, listen, the cutting laser is next door. I can cut it now, but I won't, because that's not what your baby needs. Anyway, so we're trying to lay a good foundation for them. Maybe we're biased. Maybe I'm biased because I know a lot more about all the things that happen with the development. Yes, it doesn't mean they're not going to develop. They're going to develop. But guess what? I wish my parents knew when I was 9 months of age, all the things they could have done to have prevented me from even if it's just all the 40, 50 some years of migraine headaches.
Mm-hmm. Oh my gosh, absolutely. Now,
So,
you use the baby lays
yes.
along with releases too,
Yeah.
or is it one or the other?
Before.
Or tell me like what, explain, I guess, because there are clinicians and parents both that listen to this podcast. So can you explain like what baby lays is? I don't know if they even know if it's like if they know it's like just explain what it is. Like it's a laser and like what it's working on.
Okay. Do you want to explain that and I can?
Okay, yeah. So as far as the background, baby lace, oral lace, developed by
Mhm.
Jack Nordstrom and Angie Tenholder. And it is a laser therapy. It's not laser, it's not a laser, it's a laser therapy using a specific kind of laser, in a specific, at a specific wavelength and hand pieces. And so with that, they have different or different techniques that goes over the head and the neck that at certain points, this is what they figured out. There are different acupunctural, neurological points that help to release tension and fascia in the head and neck because they understand that as it being closest to the brain and closest to the nervous system, being able to release certain tension and fascia also opens up and, connects different uh, pieces together, right? And so with the wavelength, that wavelength is reaching past the muscles, reaching past fascia, and entering into blood vessel and the nervous system for that increased flow and to be able to give the cells more life. So whenever you're doing it for a baby, you're not only just helping to release the tension, but you're also helping to integrate certain reflexes that could be still stuck and retained, right? As we've been talking about nervous system so much, there's a reason. There are certain nerves, there are certain things that do get compressed or they get tight, they get wound up. The nervous system is within the fascia, right? It's not floating, it's actually in fascia. So if fascia is stiff and crystallized, then that laser is able to melt the hyaluronic acid embedded in fascia to help increase motion and flow, which is what everything's all about. So this is something we're using pre-procedure, during the procedure, post-procedure, as much as we can use it, just because it is a therapy, right? Of course, it is increasing collagen, it's increasing all types of things, but it is a therapy. So that therapy, the effects will last a certain amount of time, but they can stack upon each other depending on how often you prescribe it and use it per patient.
And some people might be thinking like, oh, you're like a baby's gonna sit for that kind of thing. Like, can you like how
Okay.
quick does it work? Like,
Yes. So,
how long are
and
you in there for?
right. So that, and Dr. Linda can attest to it. You're really trying to capture the baby wherever you can, right? You're not forcing the child because again, we're talking about the nervous system and we're talking about a laser that helps open up some things. I don't know where that baby's been in whatever past life, right? You don't want to, or even adults,
Yeah.
right? You don't know what's hidden. So you don't ever want to force this kind of procedure
Oh
on
yeah.
any child. So you get what you can get and you'll be surprised. And it was very surprising for me as I was learning at first, like, I'm just waving a light. And I heard this in a conference when we talked about it. Aren't you just waving a light? It's like, be careful. There are parts of there are different trains and different ways in which the body has its points that you are waving a light, but you're waving it in areas that that create effect and impact.
Like there's
So
intention behind
there's
it.
intent, exactly. There's definitely intention behind it. So yes, they're not always going to stay still, but this is why you're stacking it. They get something for sure, and you're
Right.
doing it with mom, you're doing it with baby, and you're doing it at certain points, and you're getting certain points. And this it did take. We learned it, and we continue to increase our learning with it. And that's why some people ask us, "What's the setting? We're never going to give a setting to anyone. They had like taking the course and understanding what you're doing, why you're doing it,
Right.
what the laser is about is extremely important. It's not a setting at all. And Dr. Lynn can say more about it too.
Yeah, no, it is a great question because then you asked about, will they still need to have a release or will they not need to have a surgical release? And again, it is a therapy, is an adjunct, is one of the tools in our toolbox. And usually when we're doing it in conjunction with some other type of body work, because the laser therapy itself will, the fascia release and the hyaluronic acid release at 48 to 72 hours. Then the body wants to tighten back up as you're trying and stacking to say, okay, let's get this all figured out. Let's get this all loosened up.
Right.
People, a lot of the babies get something. Usually a lot of the time the mamas that tell us, oh, this is the first night they slept well, or they're feeding better, but we still know that something did cause it, and we're going to keep looking to see. So probably I'd say about a third of the babies don't have to get a release afterward, but there's continued work to get them to keep growing and guiding their growth in that sense. So the ones who don't have a really high vault palate, they're more likely not to need it. And the tongue is not like stuck up in the front. They have fairly good motion. Most of the other reflexes are good. Their body just needed a little bit of a reset. And so that's that part really. And so, yes, it is not a setting. And so, and I've had some people like after we give talks, they come back and say, so where do I have this laser, where do I set it to?
Right.
No, I refrain from doing that. That Crystal and I were two of the first 5 people in the world trained on it for babies,
Wow.
actually. And so we're very protective of it
Yeah.
and we want people to understand that it's not just like, oh, here's laser, you do this, you do that. You have to understand what lasers do and be able to know that, yes, even if I gave you a setting, every kid is different.
Right.
Every mom is different. Sometimes I have moms and I go, okay, usually I will start with the moms and they'll have them in their arm. And I'll start with the mom on the setting for adults. And she goes, oh, that's too warm. It's really supposed to feel like warm soup. It shouldn't be anything at
Right.
all.
Right. Yep.
Oh, okay. If that's too warm, I'm gonna
Yeah.
have to dial it down.
Right.
Dial it down until she's comfortable. So if it is too warm for her, then when I'm doing the baby, I have to remember that and not just have the setting for babies. I have to
Right.
dial down the setting that I would have used for just the baby for that child, for that particular baby. So, and it is a good thing because we're all individuals. Everybody is different. And that's what makes this very difficult because most people want a recipe.
Oh,
They
yeah.
want to treat everybody like one, two, three,
Right.
1, 2, 3, but it's very individualized,
Um,
customized.
And just
yeah, go ahead. Go ahead.
I just wanted to make a note about tongue ties, why we love it for it, because and why we don't just cut everything and we utilize the laser therapy so well or so much. The being able to melt the fascia and being able to make sure you're seeing actual tongue tie restriction is extremely important. Oftentimes, those tongue ties, they may look obvious or they may not. They may not. You see a wall of fascia, and that wall of fascia, we've already said the tongue is connected down to the tip of the toes. And so that could be coming from tension in the shoulders, tension in the knee, or just tension around the sublingual fascia that you have to melt and release so you can actually see the restriction. The restriction is what's not normal tissue, right? That the restriction is a mix of kinds of tissue, but once you melt and release normal fascia and tissue, you can actually see the release or the restriction to be able to release conservatively. So it just makes surgery even better anyway, like
Right.
much better. Yeah.
Right. Oh my gosh. And I'm sure, and Dr. Linda, you could probably test this more. It's probably like a night and day difference for you compared to your releases when you first started, right?
Oh,
Goodness.
oh my God. Let me tell you, I wouldn't even be surprised if they're like people who say, no, I wouldn't refer to her because, she cuts too much. I did at the time because I was doing ties and things and with older kids and things like that.
Right.
And I knew exactly what I needed to get the motion then. And I was not that person that I didn't want to have to do it again. And so I was doing what I thought the babies needed. And yeah, they got better, but it was a lot, it's not a very, it wasn't easy on them. I
Mhm.
knew that, but they were mostly good. They worked well, but it could have been better. It could
Right.
be better. And so yeah, the night and
Um,
day difference. So.
so I know I told you guys I wanted to focus on the 0 to 2 range, but I have one
So,
question
yeah.
because this just so when you're talking to a mom that has this infant and everybody's struggling, right? Their nervous system is dysregulated, mom's nervous system is dysregulated, nobody's sleeping, nobody's eating. Like, okay, you start to have the conversations about like how you talked about the way the labor, was it long, was it short, where was it assisted, was it cesarean, and how all of those things impact um, the nervous system and the importance for, I guess, okay, let me rewind. A lot of times I'll say to parents, like, it is not just about you coming here and doing the mile before the release. Like, your child needs to be ready on every level, physically, mentally, emotionally, spiritually. And that is where you're really going to get the optimal release. So, when you're working with families of older children, getting them to understand that you're still not just going to cut their child's tie. Like, how do you, because I feel like it's easier to explain to a mom that is in that, I want to do anything postpartum state. And then an older child, well, it's like, well, why do we have to why do we have to do craniosacral therapy or, osteopathic medicine? Like, why do we have to do this? How do you kind of explain that to them?
There's a lot of education. We have a lot of videos out there. We spend a lot of time with them. Their first visit with us is 90 minutes.
Wow, that's
That,
awesome.
yes. So we talk a lot about why.
Mhm.
And for a lot of them, it's connecting the dots for them.
Mhm.
By the end of, if they're our people, by the time they leave the appointment, they
Mhm.
understand why.
Right.
And for those who don't, we say, it's okay, but
Right.
that doesn't work for us.
Right.
Then, but what we find is that some of them are calling back now and going like, okay, yeah, we did it that way, but what
It
you
didn't
said was
work.
right. Yeah, absolutely. But it is daunting, at any one moment in time, whether with a skull in our hand, doing this and go see this video, see this video, this homework, that homework, and some of them come out and they're like, their eyes are frozen. So, but a lot of them are very appreciative because, and a lot of them are crying like when we're talking the new patients, they're crying because they knew inside of them that something wasn't right with their kid. And so, yeah, so it's getting a little bit easier because now they can go on Facebook and they've heard it and something's happened, but it has been a long road
It really is. This
yeah,
question you're
since
asking, I mean,
2017, yeah.
it's been, that's the other aspect that providers do um come to terms with or have to face, and that's why some decide not to go along with it. And
Right.
and some just say, okay, I'm gonna head forward because it's an expensive investment, is it is an
Right.
investment. And then just being able to sit with these parents and hold space for them, and then also tell them we have to quarterback this
Right.
and send you when it's time, when it's ready. You can't do it when you think it's ready because this is not what's good for their system. These problems started in utero. A baby practices swallowing movement of the body in utero, which is why for us, we started specializing more so niching it down to the 0 to 2 because you can't just cut. And yes, they did the cranial, they did all the things, but the problem started in utero,
Right.
right? So that's 9 months. 9 months as a baby was forming, the motor patterning in the brain was set, all types of patterning were set. So we need to unwind and guide in the right way. So that way the guidance, if you wait too long, isn't so forceful. You're using less of the doctor hand to do things. So that's when we talk about how do we talk to those parents who are just anxious and things like that, which is why we try to educate our providers so they know what to say, right? Because it is stressful. You still have to go home and be like, oh my God, I had to deal with X, Y, and Z. So everybody, that's the thing that we learned as getting into this. There were times we were like town criers with our pitchforks. We got to save everybody. You know? You know?
Kudos
And
to you
That was
though,
me.
because we get phone calls from families all the time, and like when I go to talk to the provider, I'm like, what? They're like, well, the mom really wanted it done today, and I'm like, but was she holding a gun to your head? Like the last time I checked, you're the one that is in control of the laser. Like, I'm sorry, did she take over your body? Like,
that's exactly. And the thing is, you have to understand as the parent unlearns this thing that they don't have the privilege of what we have the privilege of is going to school, synthesizing information, like sleeping on it, learning it. They're learning this like a what is it, hose coming into their mouths, and then they're shocked. My child is this, my child is that. So the other responsibility as a provider is to just hold the line, hold the space, right? You know what's best. And sometimes when some providers go too fast, mostly it's because of their own anxiety. They're like, oh, I should have done that. It's like, you too, everybody just relax. You just learned it. They just learned it. Let's all relax, right? Because the child has been okay. Like that's the other part. It's okay. This is for thriving, optimal levels of living is what, and of health span that we're looking for. Not, you can't, you have to, it takes time. It's something you can't just jump into. You have to have a plan. So yeah, you're absolutely right. It's not an easy thing, but
yeah, but I love that. And again, I think that's fantastic that, because that staying, what phrase am I looking for? Like steady in your like your core values, right?
yeah, just being grounded.
Yeah.
Mhm.
And too, like, I'm sorry, but like that's not going to give your child the best result. I'm sorry that your insurance is resetting the beginning of the year, but like that's not
That's
what
yeah.
is important here,
Yeah,
right?
No,
it's,
no.
there's a bigger fire that when it comes to the political span or
Right.
healthcare and things like that, that unfortunately we can't do anything about, right?
Yeah.
Like we're all fighting it. I tell
Right.
the parents, I'm in this with you too,
Right.
right? This is beyond me at this point. So
Yeah.
let's see what we can do. Let's try.
One more question, because I don't want to take up too much of your time. I know you guys are super busy, but I want to talk about how you guys utilize the mile munchie in that 0 to 2 range, because so often you hear like, there's no way they're going to use it. And so I'd love to hear you guys talk about how much success you have had with munchie in that age group.
Okay, now you want to put me in trouble, but that's okay. I'm always ready to get in trouble anyhow. So again, bless her heart, Mary, whose dad developed the munchie. It's a great tool. And it's wonderful because they're going, okay, chew, chew, chew. And in my mind, there's a lot more that the little thing does than just chew, chew, chew. And so for a parent who's ready to give their child a pacifier, I'm yeah, I'm kind of like, oh, you know what? Try this other thing instead, right? Because again, most pacifiers are not designed to help with the real sucking that the child needs. Okay, if a baby is premature, they need to because they never got to be able to develop that
Develop. Mhm.
system. But if they're not premature, and then you're having to console them whilst we're working on getting to the reason why they're inconsolable. Let's use something that is actually helpful. So for the real little ones, we're using it not so much to chew, 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 but one is for play, and also for nasal breathing. Because a lot of these babies, 2 days old, they come in with an open mouth posture. And we know what that means. That means the brain is just struggling to give them air. So what resource do they have to actually learn how to eat? And so, yes, we do use it, the baby munchie. And sorry, parents, unfortunately, you just can't go and buy it, at least for
No.
now. You have to have a provider be able to guide you with it, and that's a great thing. And so they use it, and I tell the parent, just put it in, even if it's 10 seconds at a time. And, and then what we find is that, okay, some babies in the beginning, they're not receptive, they don't want it. And some babies, you just get it close to their mouth, they're going, like they fixed it themselves. And even the moms are looking like this and going like, did she just do that? So we have
That
plenty
was me.
of
My girls, I was shocked that they literally, I put it right to their mouth and just in it went, and they just started like,
yeah,
like,
they'll be, yeah,
it's
yeah.
really cool. And they were
They're
4 months when
very
I did it for the first time.
oh yeah, I would get them in 2 weeks.
Yeah.
And get them in. And so, and they're finding that some of them are finding it, using it more than they use a pacifier. So for me, that's a win, really.
Mhm.
And then when the time when they're ready to chew, which is usually between 4 to 6 months, obviously there are different criteria. They have to know the baby can hold their head up in order to start solids with them. But even getting the munchie at that time, they'll be chewing on it themselves, and you can use it as a teething toy. You can freeze it. You can put some homemade
Breast
smoothies
milk.
in it, and avocado, those kinds of things for them, and they kind of just kind of mush on it as well. And maybe that goes into the other part, and it's not what you asked. However, but that time chewing becomes very critical, because
Mhm.
that's how the lower jaw starts to grow. That's how the TMD starts to develop. And if they miss that window, then it's almost like the brain's like, okay, they don't need this. And that all starts to retard how well the lower jaw can grow.
Mhm. Oh my gosh, such an incredible episode. I mean, really, all the value that you guys brought. I thank you so, so much. Again, I know you guys are incredibly busy, so I'm so happy we were able to do this. Thank you so, so much for coming on. And then let's one final question I always like to ask everybody. Any last remarks you want to leave for the listeners? And two, where can the listeners find you? Like social media wise, website?
Yeah. Well, in terms of last remarks, for me, I would tell the moms to just have grace for themselves,
Mhm.
be chill, be
Mhm.
calm, because their baby is taking from your nervous system.
Mhm.
So sometimes, I don't want to say this on the podcast, but sometimes I go, okay, go have half a glass of wine, just that, and then just chill, right?
Yeah,
And
sometimes
get
we need
whatever,
that.
yeah, whatever gets you to relax,
Yeah.
just do that, because the baby is going to feed off of you.
Mhm.
And if you have something in your gut that tells you that something is not right, keep asking questions. You're going to meet providers who are going to tell you, oh, they're going to grow out of it.
Mhm.
No, they don't grow out of it, they grow into it. So
Mhm.
the sooner you can get them help, the sooner you can have the baby you were meant to have back. So Dr. Crystal, what's
Yeah, no, that's really great. And Brittany, thank you so much for having us. This has been really awesome. As you can see, we love talking about this. We love what we do and the impact we've had. But the last thing I'd like to leave for parents and moms, families is just if you decide that, okay, this is too much for you, to start early. It's never too late, because what Dr. Linda said was true. They don't grow out of any of these things. They grow around those dysfunctions. So it's just that it's never too late, but earlier is better. So is something to think about for sure. And if you're thinking about having a baby, start taking care of your jaw development, your breathing health, your sleep. Extremely, extremely important, because you're an athlete.
Oh my gosh, I love that. Oh my God, I
anything?
just got the chills when you said that because it's so true. It is never too late. So
Yeah.
I think both your advices, like giving grace, that is something like I have to remind myself on a daily basis. And it's true, but we have to, right? Like we are literally, we have the hardest job as moms, right? We're doing the best we can with the information we have. And maybe this is the first time you're listening to a podcast like this and these things are resonating with you. Keep asking questions. Keep asking
Absolutely.
questions. So thank you, ladies, so much.
Wow.
I really
Oh
appreciate
yeah,
it.
where you can find us, right?
Oh, yes, 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 yes. Sorry. I would link it in the show notes anyways, but let's actually definitely say it on the podcast.
Yes,
All
yes,
right.
definitely.
So if
Our,
you're looking, go ahead, Dr.
Oh,
Crystal.
yeah. So if you're looking for us online, our website is www.kidsmile.com. Stay tuned for the Womb to Grow wellness website, womb2grow.com. And then we are on the socials. We are on Instagram, Ashburn Children's Dentistry, on Facebook, and on TikTok as Womb to Grow Wellness. So that's also fun. There's some fun things there. Lots of good information as well.
Oh, the good old
Everyone
phone.
go
Sounds
and follow. I'm sure that the information that they're providing is absolutely
Mhm.
amazing. So again, thank you for coming on, and I appreciate you guys and all that you're doing every single day.
Thank you
thank you,
so much,
Brittany.
Brittany. We
It's
really
wonderful.
appreciate it.